One of the earlier videos I explained that very often after plastic surgery procedures, the anatomy of the lymphatic system changes, and it's because lymph fluid can't go through scar tissue. So when a patient has had a facelift, the most common place for the scar is from just in front of the ear, and it comes right round here and up to behind the ear. The tissue is dissected, so the skin and the first layer of the fatty tissue is dissected from the underlying muscle. So the lymph nodes here in front of the ear and just at the base of the ear and then round here aren't servicing the face. So the fluid that is as a result of the trauma from the procedure often gets stuck in the tissues. So what we want to do is to reroute to different lymph nodes, and those would be along the jawline here. So in the first 2 weeks, I would be rerouting down to these lymph nodes along the jaw, and then down onto the nodes on the neck and into the supraclavicular fossa. So when you're doing your MLD treatment, you always start off first of all doing your neck treatment, and then I'm just quickly going to demonstrate how I would do then the face treatment after a facelift. So you've got to be mindful of the sutures and the dressings. So it's just very, very gentle stationary circles, really using the tops of your fingertips. Very gentle, because you don't want to be stretching the scar. So 5 to 7. And then the lymph nodes under the chin. Depending on the time that you have, you can do a full face treatment. I generally give about 40 minutes for a facial MLD. So I often don't do the full face. So remember, you're always clearing your pathways and then rinsing through. So for the sake of the video, I'm going to jump ahead to this cone here. So remember, you have a cone from the bridge of the nose down to about the corner of the jaw. Normally everything above that cone would drain to the lymph nodes here at your ear, and everything below that drains to the lymph nodes at the base of the ear. But we want to just gently bring everything down to the lymph nodes, the base of the jaw. So nice, gentle, stationary circles, just using tips of your fingers. Okay, so when you've done that, you've done your clearing and then your rinsing. You're coming along the jawline again. If you just turn your head to the side. then when you have done that, and into the SCF again.